Interprofessional Communication CSB 346. For my presentation today, I'll be reflecting on interprofessional communication and its importance as I become a novice practitioner in the ambulance service. My presentation will focus on the importance of interprofessional communication during clinical handovers and documentation. I will also discuss the challenges that may arise due to communication breakdown and ways to overcome the barriers of communication. I chose to do this topic as interprofessional communication skills are essential to the healthcare practitioner, aiding in high quality, effective and safe clinical practice. Effective communication exerts a positive influence on the patient's physical and emotional state, resulting in better patient outcomes and satisfaction. Interprofessional communication is a concept of communication amongst healthcare professionals, patients and their families and their community regarding their healthcare needs and responsibilities. Communication is as old as humanity. With every year, technologies improve, innovative treatment options are developed, and our understanding of disease and the human body advances. But for all of that, the most important and powerful tool is as old as civilization itself: effective communication. The International Charter for Human Values in Healthcare says, communication is an essential clinical skill with considerable science behind it, not an optional add-on and not simply a social skill at which we are already adept. Effective communication is a skill that all healthcare professionals need, but one that not all are naturally good at. In a single day, paramedics speak to people of varying educational, cultural, and social backgrounds, and they must do it in an effective, caring, and professional manner. Interprofessional communication should promote shared decision-making and shared responsibilities, respect, and interprofessional collaboration. Interprofessional communication between healthcare professionals can occur within various settings, which include handovers, general conversation, meetings, written notes, and documentation, and education with patients and their families. There are multiple and standard ways healthcare professionals can facilitate effective interprofessional communication, and some of these ways are actively listening to verbal and non-verbal communication cues, achieving shared goals, and understanding with other healthcare professionals and patients and their families regarding their treatment plan and pathways, also using the most up-to-date evidence-based practice. When interprofessional communication is built between healthcare professionals, patients are able to have positive outcomes, and it is so important for patient-centered care. Paramedics and other healthcare professionals who take the time to listen and understand the concerns of each of their patients are better prepared to address issues as they arise, resulting in better patient outcomes. Additionally, patients who have established an open and secure dialogue with the paramedic are more likely to disclose the true extent of their symptoms. Interprofessional communication skills influence the quality of decisions made, as well as the level of patient motivation to follow treatment protocols and achieve desired clinical outcomes. An area of interprofessional communication that is significant to paramedics is documentation. Clinical documentation is a form of communication which supports interprofessional collaboration and a patient's continuity of care. Under the Domain 4 of the Professional Capabilities for Registered Paramedics managed by AHPRA, Paramedics must maintain records appropriately by recording information in a systematic way, having the information accessible and retrievable, and ensure confidentiality and privacy is maintained. Maintain accurate and comprehensive, logical, legible, and concise records. Use up-to-date and accepted medical terminology when completing clinical documentation, and ensure that the patient information is recorded, communicated, and reviewed in a manner that is accurate, consistent with current protocols and current procedures, and is also relevant to the legal protocols. With these requirements, paramedics are able to protect patients and others by minimizing factors that may place patients at risk of ambiguity at their care, and improves communication between healthcare providers. Undocumented or poorly documented information relies on memory and is less likely to be communicated and retained. This can lead to loss of information, which can lead to misdiagnosis and harm. To further this, poor communication and documentation in healthcare can lead to patients misunderstanding directions and failing to follow treatment protocols. It can also lead to workflow breakdowns on the healthcare professional teams, resulting in medical errors. A report by the Joint Commission found that poor communication and documentation in healthcare during patient transfers contributed to 80% of serious medical errors. Paramedics play a crucial role in the transfer of patients to the emergency department staff through the use of clinical handovers. Clinical handover is a summary of the assessment and treatment provided to the patient to medical and nursing staff responsible for the continued care and management of the patient. A clinical handover must accurately, succinctly convey important case details and any treatment or management received by the patient. In an emergency situation, whether it be trauma or medical, the next treatment decisions may be guided by the information provided in the clinical handover by the paramedics. The use of a standard process for clinical handovers has been shown to improve the safety of the patient care because critical information is more likely to be transferred and acted upon. The handover tool specific to paramedics is laid out in a format called IPC AMBO, which discusses identification, mechanism, the medical complaint, injuries, or information relating to the complaint, signs and symptoms, treatment and trends. And the AMBO part is allergies, medication, background and history, and other information. IPC AMBO aligns with the other mnemonic ISBAR, but as a student paramedic, I have been trained with IPC AMBO as Australian Ambulance Services use it. Prior to the commencement of a patient transfer and handover, the paramedic should determine to whom and when the transfer of responsibility will occur. An effective clinical handover is confident and succinct, advocates for the patient, is clearly stated, it is assertive and loud to be able to be heard over the hospital noise and chaos, it needs to be structured, should not contain irrelevant information, and is consistent with the written documentation. And it also provides an opportunity for questions and feedback. As a future healthcare professional, it is crucial that when I'm on placement, I take each opportunity to learn, practice, and become efficient with my clinical handovers to be able to manage them appropriately and to communicate effectively to ensure that each patient in my care is supported and optimal care is provided to them. I want to ensure that the safety of my patient is paramount and in my delivery of care, especially with cultural awareness. As a future paramedic, I will likely work with people who come from a wide range of social, cultural, and educational backgrounds. Every patient, co-worker, and healthcare professional is unique, and it is important to be aware and sensitive. For example, gauge the patient's fluency in English and grade my vocabulary accordingly to bring a translator if necessary and if it is possible. With trans and non-binary patients, be sure to use their preferred pronouns. Conveying compassion and understanding is an essential skill in communication. On completion of this presentation, I would like to recognise that I have learnt that delivering a handover on a structured format allows myself to produce a specific and accurate and relevant information to the receiving healthcare professional. I have also learnt that clinical documentation needs to be relevant and accurate and the patient situation to ensure the appropriate care and treatment is provided and received. Also, through continued education and the conscious practice of effective communication, I, as a novice healthcare professional, hope to overcome the barriers and challenges of communication in healthcare. Thank you.